So we already talked about primary dysmenorrhea in detail in our first two sections. Now we will talk about what's secondary dysmenorrhea and what are the different causes of the secondary dysmenorrhea. So in this section we will talk about how the secondary dysmenorrhea present and what are the clinical features of secondary dysmenorrhea, and also what's ovarian dysmenorrhea. So secondary dysmenorrhea can be congestive, and the causes of pain in congestive secondary dysmenorrhea is related to increased tension in the pelvic tissue due to premenstrual pelvic congestion and increased vascularity in the pelvic organ. So premenstrual, there is increase in the congestion or the blood supply of the vascular organs or pelvic organs, increased blood supply of the pelvic organ. All these can lead to congestion of the pelvis, and this congestion of the pelvis or congestion of the uterine muscles leads to increased contraction or increased tension and cause pain. Causes of unilateral dysmenorrhea, or on the one side usually there's ovarian dysmenorrhea. If there is bicornuate uterus, if the shape of the uterus is not normal or it's bicornuate uterus, unilateral location of pelvic endometriosis, small fibroid polyp near one cornua, right ovarian vein syndrome, and colonic or cecal spasm. All these are the causes of dysmenorrhea on one side or unilateral dysmenorrhea. Fibroids, renal ovarian, right ovarian vein syndrome, ovarian vein in which the vein becomes enlarged and big and cause varicose veins. It can also cause the pain. So all these are the causes of unilateral dysmenorrhea. Some causes of secondary dysmenorrhea. Secondary dysmenorrhea can be due to cervical stenosis, or if the cavity of the cervix is narrow, it can lead to secondary dysmenorrhea. Chronic pelvic infections can lead to dysmenorrhea, secondary dysmenorrhea, endometriosis or pelvic adhesions, adenomyosis, uterine fibroids, endometrial polyp, IUCD in uterus, intrauterine contraceptive device, or pelvic congestion. So all these are common causes of secondary dysmenorrhea. Cervical stenosis, if the opening is narrow or is stenosed, the contraction of the uterus is unable to push the blood through the narrow cervical opening, so that leads to secondary dysmenorrhea. Also, if there is infections or inflammation, it can lead to dysmenorrhea. Endometriosis. Endometriosis is the condition in which there is presence of the endometrium not only inside the uterus but other areas of the pelvic structures or in other pelvic organs like ovaries, fallopian tubes, and this can lead to dysmenorrhea. Adenomyosis, when there is invasion of endometrium into the muscle layer of the uterus, and then if there are fibroids or polyps present, all these are the very common cause of secondary dysmenorrhea. And if patient has complaint of secondary dysmenorrhea, all these should be ruled out. Clinical features of the secondary dysmenorrhea, as we saw for the primary dysmenorrhea, the patients are usually young adolescent age, but in secondary dysmenorrhea, age is in the 30s. So women in their 30s usually have secondary dysmenorrhea. They have dull pain, appears 3 to 5 days prior to the period. So they have dull pain 3 to 5 days before the onset of menstrual cycle. Relieves with the start of bleeding. Treatment depends on the severity, age, and parity of the patient. Ovarian dysmenorrhea. Ovarian dysmenorrhea, if there is high testosterone and polycystic ovarian syndrome. In polycystic ovarian syndrome, there are multiple cysts present in the ovaries, and these patients usually they do not ovulate normally, and they have problem in conception and ovulation. So polycystic ovary syndrome. So ovarian dysmenorrhea, right ovarian vein syndrome, in which the veins are engorged or swollen. There is pressure on ureter, and as a result of pressure on ureter, there is stasis, and there is infection or pyelonephritis that leads to pain. So one reason for ovarian dysmenorrhea is there is swelling of the ovarian vein, and this causes pressure on the ureter, and this can lead to infections and pyelonephritis and pain. So that was all about the secondary dysmenorrhea, how it can present and treated and managed. Thank you for watching sqadia.com.